So I am back once again. Am I audible? So it's time to practice one-to-one, some kind of homework assessment, because we have given some homework to practice between the partners, between the participants from the last session after musculoskeletal system. So I will now assess how the candidates have practiced. So this is something like homework assessment. So Dr. Shushmita, are you hearing me?
Yes, doctor.
So I'm going to give you the case. So in this practice session, you'll be given 11 minutes because in the real exam scenario, you have to do examination physically. So it will need a lot of time and a lot of things others need. So after 9 minutes, I will give you a warning that you have 2 minutes left. Is it okay, doctor?
Okay.
Now, this is your scenario. You have 2 minutes time to take preparation. After that, we'll start.
So, okay, we can start.
Are you ready? Okay, start, doctor.
Hello, I'm Dr. Islam, one of the doctor in this clinic. Be presenting. Am I sure that you are Mrs. X, 40 years old?
Yes, doctor. I'm Mrs. Jessica. I'm 40 years old.
Today, I'm here to ask you some questions regarding your health issue. At the same time, I also need to examine you. And I may took some note. I will assure you that it will remain confidential. So, can you please tell me what actually brought you here today?
Doctor, I'm having some hand pain for the past 15 days, doctor. It started gradually, and I'm very much anxious about it, doctor. I don't know what is causing pain to me, doctor. Please help me.
I'm really sorry to hear that. And after taking history exam, I will give you some painkiller to improve your condition. Is that okay to you, Mrs. Jessica?
Okay, doctor.
Okay, so can you please tell me what actually mean by hand pain? Is there any joint pain or any pain after exposure to the cold or anything like that?
Doctor, I feel pain after exposure to the cold.
Do you have any time any tingling or numbness of the hand that after improve with shaking?
No, doctor. Nothing like that.
Okay. Okay. So you told me that after exposure to the cold, there is some pain. Do you notice any color change?
Yes, doctor. My color changes gradually. Whenever I'm having this pain after going to the cold, I feel pain and the color gradually changes one by one.
Like white, blue, red, like
this? Yes, doctor. You are right, doctor. Exactly.
Okay. Is your one hand or both hand?
Both the hands, doctor.
Okay. And do you have any joint pain anywhere?
No, doctor.
Okay. And you told me it is for 15 days. It is progressive day by day. Anything aggravate your condition?
Whenever
your hand
I
to cold.
went out to the cold, I feel this hand pain, doctor. It comes and goes. It is not there all the time.
Okay. Do you have anything done like any vibrating machine or anything like that?
Doctor, actually, I love gardening. And during gardening, some vibrating tools I have to use.
Okay.
That is the thing I
and
use, doctor.
anything relieving your condition?
Whenever I warm my hand, I think my pain goes on. Gradually, it goes on, doctor.
Okay. Okay, and if I score you to 0 to 10, and 10 is the maximum, how can you score your pain?
Whenever the pain comes, it is doctor 6 out of 10. It is very severe pain, doctor. I barely can bear it, doctor.
Okay, and can you please show your hand, please? Actually, where is the pain? This area, whole area, you have pain?
Yes, patient is showing her hand. She is feeling pain at the tip of the fingers or both hand.
With the finger. Okay, any trauma to any time?
No, doctor.
Okay, does the pain goes anywhere?
No, doctor. It stays only
Okay.
at the tip of the hands.
Okay, do you have any past history that I should be aware of?
No, doctor.
Okay, any surgical history?
No.
Any hospital admission?
No, doctor.
Any procedure, like dental
No.
procedure or anything?
No, doctor.
Okay, and do you take any medication that I should be aware of?
Yes, doctor. I take some. In the regarding past medical history, I'm having some anxiety issue, doctor. For this problem, my psychiatrist or mood doctor has started for me some medication. Like right now, I'm taking citalopram 5 milligram once daily, and also propanolol 10 milligram 3 times daily.
Okay, okay. And do you recently change any dose?
No, doctor, I'm quite compliant with my medication, and I'm feeling well for that, doctor.
Okay, do you take any medication, over-the-counter medication?
No, doctor.
Any herbal medication?
No, doctor.
Any allergy to any medication?
No, doctor, I'm not having any allergy.
Okay, any family history that I should be aware of, like some type of joint pain or some type of hand pain?
Yes, doctor, my mother also used to have some joint pain. It was diagnosed later on like rheumatoid arthritis.
Okay. So I want to ask you some more question. Like, do you have any, besides, do you have any weakness when you're standing from sitting position
No, doctor.
or coming here?
No, doctor.
Okay. Any skin thickening?
Yes, doctor, I'm having some skin thickening.
Okay. Any problem in your eye, like grittiness of eye or
No,
grittiness of
doctor.
mouth?
No, doctor.
Any pain or redness of your eye?
No, doctor.
Okay. Any difficulty in swallowing?
Yes, doctor, I'm having some difficulty in swallowing.
Okay. Is it both liquid and solid?
Yes, doctor, with the boat. I feel like something is stuck behind my chest.
Okay. So to have that, do you have any loss of hair anytime? Notice?
No, doctor.
Okay. And any cough?
No, doctor.
Any shortness of breath?
No, doctor.
Any racing and pacing of the heart?
No, doctor.
What about your bowel habit? Is there any alteration of the bowel habit, loose motion or
No, doctor.
anything?
No, doctor.
Okay. Any change of your work, like change the nutrition volume?
My water
Change.
is normal right now, doctor.
Okay. Any color change or frothiness?
No, doctor.
Okay. Do you have nutrition chest pain?
No, doctor.
So okay, I want to examine you. Is that okay
Sure.
too?
Sure, doctor.
Okay, first I want to need a pillow, and please raise your hand over the pillow. First I want to check the hand,
Okay. What do you want to check?
especially in is there any ulcer, or in fingertip is there
Yes.
any
There is ulcer at the right fingertip. At the fingertips of the right hand, there is ulcer.
right hand is there any blackening or amputation?
No. Only ulcer is
Okay,
there.
so okay, so I want to show this patient. Can you please do like this for me? Pinching of my left hand, dorsum of
Yes.
the hand, and also above the
Yes.
elbow.
Skin thickening. Skin thickening is present below the elbow.
Below the elbow. Okay. And do you have any like heartburn or acid sensation of your mouth?
Yes, doctor. Sometimes I'm having these symptoms. Also with a difficulty swallowing.
Okay. In skin, is there any scalodactyly or like bending or flexion of the finger?
Yes, it is present.
Okay. Okay. So can you do like this for me? I want to check the proximal myopathy.
Absent.
Absent. And just hair loss. I want to check the eye. I want to touch your face, please. And anemia. I want to check the anemia. Is there anemia? And
Absent.
can you please open your mouth? Can you please
Yes.
open your mouth? Is there any difficulty of mouth?
Yes,
Opening.
there is reduced mouth opening.
due to mouth opening. So I want to check the pulmonary hypertension, pulmonary hip, and in
Absent.
lungs, is there any capitation? Is the
Absent.
okay, absent. And do you have any tummy pain anywhere?
No, doctor.
Okay, and any leg edema?
Absent.
Okay, so just I want to ask one more question. Can you please open and fist your finger? Do like
Yes.
this.
It is difficult because there is sclerotectomy.
Okay, sorry. And can you please hold this pen for me?
Yes, she is able to do that. Wonderful, doctor.
Okay. Okay, so I want to ask you something. As you have some problem, as you have some difficulty in problem to do this, so it may affect your daily living, right?
Yes, it would be helpful if you can offer me some help.
Okay, if you want any help, I will refer to the social worker. They will help you regarding this issue.
Okay, doctor.
Okay, and I'll also advise you to avoid the cold and wear the gloves, and you take some medication for mood relieving medication like propranolol. You have to review this medication, and you may stop this medication. I will refer you to the heart doctor or mood doctor to give you the safer medication, and at the same time I also give you some medication that will help to relieve your pain in the hand. And
Okay, doctor.
Okay, so what your concern?
Doctor, why I am having this hand pain?
Okay, and before this, I just
2
have
minutes left.
one more question. Do you have any history of smoking or ever smoking?
No, doctor.
Okay, and any do any job anywhere?
I am a housewife, doctor.
Okay, so now I'm going to meet your concern. So I think that you have a condition, we call it systemic sclerosis. Don't bother the medical term. There's a different system problem. Due to this different system problem, it may affect your skin. Sometimes it may affect a joint, lungs, and also there's some hand problem. We call it Raynaud phenomenon. Don't bother the medical term. Usually this type of condition, there is some squeezing of your blood channel. For that, you have, due to cold exposure, you have this type of hand pain, and it is related to your defense system problem. We call it systemic sclerosis. Are you getting me?
Yes, doctor. Do I need admission, doctor?
At this moment, you do not need any admission. We want to do it from a specific group of doctor involving the skin doctor, a lung doctor, and also we give you some painkiller medication and do some blood test and imaging also to confirm your diagnosis. Do you have any other concern?
Doctor, is it curable?
Yes, it is a curable condition. Sorry, it is a not curable condition, but we can control it by giving some medication. There is some different treatment option for you.
Okay, doctor. Thank you.
Okay, and
you still have 20 seconds left.
20 seconds. Okay. এখানে ফেসে ফেশিয়াল টেলেঞ্জেকটেশিয়াটা একটা মানে আমি দেখতেছি কিন্তু আপনারা চেক করার সময় একটু ইয়া করতে।
Okay. 4 seconds left. Time's up. So, doctor, do you have any diagnosis or differential diagnosis?
Okay, I have some. I have a diagnosis, and I also, based on hand pain or Raynaud phenomenon, I have some differential. My first diagnosis is it's a case of limited systemic sclerosis or scleroderma, but I want to exclude the mixed connective tissue disease or overlapping syndrome, though there is no other history of the proximal myopathy or any joint pain or any muscle pain. Sorry, I don't ask the muscle pain, but there's no proximal myopathy or any other feature that's
Doctor, look at the prompt.
The mixed connective tissue disease.
Doctor, look at the prompt. What was the prompt there?
Hand
the
pain.
prompt was hand pain. So I'm asking you, what are your differential diagnosis for this hand pain?
Yes, sorry, it's a case of Raynaud phenomenon. It is secondary to the scleroderma.
Yes, this will be the answer. You have to tell the differential diagnosis for the prompt. Then, if I can ask you that what can be the cause of Raynaud's phenomenon, then you have to give the answer. Are you getting myself? Okay. Yes, so, doctor, what are your positive physical findings?
Okay, there is some ulceration of the fingertip and skin tightening below the elbow and skin tightening below the elbow, and there is some telangiectasia tissue over the face and microstomia and on history I have there is some tightening of the skin, hand pain, and that after exposure to the cold, and there is some skin tightening, dysphagia, and some ulcer over the hand, and also dark history there is a taking propanol for anxiety, and there's also use some gardening in case of use some vibrating tool that may exacerbate her condition, and also some
Okay.
history of the acid brush,
Okay.
maybe
So
GERD
how?
associated with that.
Okay, doctor. So how you are going to investigate this lady?
At first, I want to confirm the diagnosis, but nail fold capillary and to check is there any capillary vessels, there's any disruption of the capillary vessels, and for cause or limited system sclerosis, I want to do um, uh, anti-centromere antibody and anti-RNA ribosomal antibody is to exclude the mismatched tissue disease, anti-UN1 RNP antibody, and also apart from the basic investigation, I want to do like some routine investigation, CBCSR, selective protein, or renal function,
Okay.
chest X-ray, ECG and echo to exclude pulmonary hypertension, and
Okay.
esophageal manometry to exclude the dysphagia, cause of the
Yes.
dysphagia.
Yes, doctor. So you can distribute it in, like, apart from basic investigation to confirm my diagnosis, then to find out the cause, then to find out the complication.
Right.
Are you getting? Yeah. This will
Yes.
be easier, and the examiner will give you
Easier.
full mark. Okay, I'm telling you during the analysis. So how you are going to manage?
First, some general measure and some pharmacological measure. In general measure, I advise to avoid the cold and wear the gloves, and also avoid or stop the use of the vibrating tool, and also stop the medication like propanol and some pharmacological management. I will give some calcium channel blocker for Raynaud phenomenon, and if it is not improved, digital sympathectomy, and for scleroderma renal crisis for complications. Sorry, for main cause of the scleroderma, I will. If skin condition, I can give the methotrexate, and for other condition like GERD, I can give him some pantoprazole, and uh, and if there is any other problem like pulmonary hypertension or like any other lung fibrosis, so do accordingly, refer to the accordingly this cardiologist or heart, lung doctor, pulmonologist.
Okay, doctor. Now let me analyze your performance. So analyze it from the, sorry. Just a minute, doctor. So we have to know how the marks are given, so that we have to practice it. I request everyone during practice between the participants, use this mark sheet, so that you will understand what the examiners want. Whenever you are practicing with other partners of this member, try to use this mark sheet and give you constructive feedback to your partners using this mark sheet. So this is a case of hand pain due to Raynaud's. In the physical examination, you have basically done all the things, except for, did you check for calcinosis?
No, I'm sorry.
Yeah, actually what
Don't
mind
ask
does,
regarding calcinosis.
yes. So we have to prepare beforehand that in case of systemic sclerosis patient, we have to check for calcinosis. We have to keep it in mind beforehand. Otherwise, what mind does not show, no eyes cannot see. So you miss the calcinosis, and I had put this in the positive physical findings. So only for missing this thing, apart from these all other things you have checked. So you have missed this calcinosis. That is why you get borderline in the identified physical sign. But sorry, I have it not here. You have done all the necessary physical examination. So you will get satisfactory in the physical examination. Is it clear, doctor?
Clear.
In the identifying physical sign, just you missed the calcinosis. That is why you will get borderline. In the clinical communication skill, did you ask about the alcohol? Did you ask about the
No.
impaction on job and daily life? Did you ask about the driving?
No driving, but impact on life. I asked, is there any difficulty for that hand? You have some problem in your daily activity. I just asked like this.
Yeah, you asked this. Yes, better to ask it in the format like how this symptom is affecting your job and daily activity. Because what happens in the PCS exam, sometimes there are some old examiner. Their ear is not as powerful as you and me. So try to tell the things in such a way so that it is easier for the examiner to pick up. If the examiner does not understand what you are telling, he can cut your mark. You cannot tell anything. And also, you have completely missed the female history, the 5P.
Right. Yes. Yes.
Pill, period, pregnancy. And if you asked the pill history, I would tell you that I'm taking OCP.
Right.
And for this case, you have to stop the OCP, path controlling pill. And what another important thing you have to tell to the examiner after stopping the path controlling pill? Can you tell me?
I will refer to the woman doctor for safer.
Exactly. Yes,
method.
doctor. Yes, doctor. After stopping the path controlling pill, we have to refer the patient to the woman doctor for some alternative method. So you have missed the biggest thing. That is why
biggest thing, right?
Some examiner will give you unsatisfactory. This is for sure.
Right.
You'll get borderline here. In the differential diagnosis, whenever telling, after doing the examination, meeting the consent, there will be basically three questions. What are your diagnosis or differential diagnosis? What are your positive physical findings? How will you investigate? How will you manage? These are the four questions you have to prepare beforehand. If you tell this question smart and professional way, you will get the full mark. So during telling the differential diagnosis, tell the differential diagnosis for the given prompt. Are you getting myself?
Right.
If your prompt is hand pain,
right.
for this hand pain, you can tell other differential diagnosis like joint pain. But against that, from the history, I have not got any history of joint pain. This hand pain could be due to Takasu arthritis, but I have not got anything from the history and physical examination for this. Are you getting my point, Dr. Shushmita?
Right, right. Okay, I understand.
That
differential is for hand pain.
Yes, differential is for hand pain,
for hand pain.
And the given prompt. That is why knowing the differential diagnosis earlier is very much important to tell the differential diagnosis. That is why to make you improve, I will give you a borderline here.
Okay.
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 Next, come to the clinical judgment. In the clinical judgment, during telling the investigation, start like this. I have told you, for this case, apart from basic investigation, to confirm my diagnosis of Raynaud's phenomenon, I will do bedside capillaroscopy. Then, to find out the cause of this Raynaud's phenomenon, I would like to check the anti-centromere antibody, anti-SCL70 antibody, and also anti-E1 RMP antibody. Are you getting myself, doctor? Then, looking for the complication, like whether there is any lung fibrosis or not, I like to check the chest X-ray, pulmonary function test, and HRCT. Looking for the complication of gastroesophageal motility disorder. She is having dysphagia. First, I have to confirm it by doing esophageal manometry. That's it.
Okay.
So these are the investigation to confirm the complication. For association, there will be no investigation in this case. And all of this has been explained in the recording of the respective cases that has been provided to you earlier, doctor. You need to make your own note by going through the recording. And during management,
but I asked about the nail-full laparoscopy.
Yeah, you have told this. Yeah, you have told this. But try to tell this in professional way so that whenever I ask
more
you,
professional way. Okay, this more professional way. There's some professionalism is.
Yes, you are showing. It is showing that you are not confident enough.
Right.
In the meeting concern, okay, in the management, in the PACES exam, there will be two types of case. One is acute case, another one is stable case. This is a stable case. For any acute case, we have to start with admit the patient, then management of airway, breathing, and circulation. After that, you have to educate and counseling, forming a multidisciplinary team. For stable case, the first thing will be education and counseling and forming a multidisciplinary team. This multidisciplinary team is a must for UK. They like the multidisciplinary approach. So I will request you to tell it in professional way. Like I will educate and counseling, forming a multidisciplinary team, then tell then treatment of the underlying cause and treatment of the complication. After that, pause for some time. So that
actually, in multidisciplinary team, I told it like that there's a specific group of doctor, as some who does some tell that there's a multidisciplinary team. Sometimes may show that it is jargon. So I told it there's a specific group of doctor like this.
But for myself, I have told it for 2 times.
Multidisciplinary team, right?
Yeah, and never utter the members of the multidisciplinary team. Why? I'm telling you a practical example. You have uttered the name of lung doctor. Why lung doctor is important here? Is there any pulmonary fibrosis?
No.
What happened to myself?
Some mistake. There's some mistake. Okay.
What happened to myself? I'm giving a practical example. During my first attempt at Bangalore Center, I got a case at cardiac short case. That was a case of mitral stenosis. So during multidisciplinary team, I told the members of the name of the members of multidisciplinary, that the cardiologist, that I also named hematologist. Then the examiner was stuck me at that point. Why hematologist, doctor? Then I told you that for starting the anticoagulant, I want to take some remark from the hematologist. And my examination was stopped at that point. He was again and again asked me, why hematologist, doctor? So you want to refer this patient to hematologist only to start the anticoagulant? And when the feedback came,
understand. Sometimes, sometimes examination due to some anxiety, I may slip of tongue and some wrong member, right? Yes,
so
that's right.
Better to not to utter the name of the member, rather telling only multidisciplinary.
Multidisciplinary, okay, right. Okay,
yes. That you have told the lung doctor. Anything you utter from the mouth.
But this patient is not have any pulmonary fibrosis.
Yes, doctor. Yes, doctor. The examiner is very much helpful in the PACES exam, unless you tell something wrong. If you tell something wrong, some examiner will stuck you at that point. And when the feedback came, although I could make the diagnosis, but I got some poor mark only for telling this hematologist. That is why tell in a small sentence. Don't tell anything which can put you into some trouble. Then you have to tell treatment of the underlying cause and treatment of the complication. After that, you have to stop and wait for the another question. Why this is? Because this is a trick to kill your time. If you answer all the questions in one go, the examiner will jump to another question. Although he will not cut mark, believe me. If you can answer only the management, you will get the full mark.
Treatment of first, treatment of complication. And then stop.
Then the examiner will invite questions. Suppose the cause is Raynaud's phenomenon. What treatment you are going to advise? So it will kill some time. So that it will kill some time and you will be able to give the answer confidently. If you are not able to provide one answer, that can create some internal pressure inside you. That will affect the another station after this long case. So to minimize this, never give all the answers in one go. Rather, try to give some indirect answer so that you can kill some time. Is it clear, Dr. Sushmita?
Okay, clear. First, I told that education in chronic case, like chronic restable cases, patient education counseling, multidisciplinary treatment of cause, treatment of complication. And in suppose in any acute cause, I'll admission, ABC management, and
yes. Then education counseling
team.
must have been, then treatment of the cause, treatment of the complication. After that, pause.
Okay.
And don't tell the answer in hurry. Just tell in a slow pace so that you can kill some time, because 5 minutes is a long time.
Okay. Right.
Are you getting my point, doctor?
Yes. Okay. Thank you, doctor. I understand.
These are simple tricks to get the full mark in the clinical judgment. Then you have told the clinical judgment well apart from the lung doctor. Believe me, if you some examiner can stuck you at that point. Why lung doctor? Doctor, do you think it is important? So why to keep in such scenario? So you will get satisfactory here. Managing patient consent is satisfactory. Welfare is satisfactory. So the mark will be calculated from each examiner. So you have got in physical examination 2, identification physical examination 1, clinical communication 1, differential diagnosis 1, clinical judgment and managing patient consent and welfare, both of them for 2 for each. So it is 6, 6 and 3, 9, 9 and 2, 11. So it is 11 out of 14 from each examiner. Then we have to multiply it into 2. So it will be total 22 out of 28. And this is the way you can practice with your partner.
Okay.
Is it clear, Dr. Sushmita?
Clear.
Okay. Do you have any question regarding this scenario?
No, thank you. Thank you very much. Understand.
Okay.
There's some, and I also a little bit, I have to practice more.
You have to practice more, and I have given the
6 to 7 months. There's a off without any practice. There's some slowness.
Believe me,
and
doctor.
Unprofessionalism.
Believe me, doctor. I have seen. This is the 6th batch. I have seen many candidates who was during starting they were more weak than you, but after going 6 to 7 sessions, doing regular practice, they have done wonderful. Recently, 2 candidates have appeared their theory exam. They have just sent me message that doctor, we did not have any idea about long clinical consultation, and both of them have performed very much well. After taking feedback from them, I have given the scenario in our group. So this is just a matter of practice. If you continue doing the practice, it is sure that after 6 or 7 sessions, you will be okay.
Okay, I think so. Thank you, doctor.
Okay, doctor.
Sir, sir, this is Dr. Venkat, sir. Sir,
yes,
hand pain, functional capacity needs to be assessed, no, sir?
Yes, doctor. Functional capacity has to be must. Any hand pain,
anything? No, sir.
No. She has examined the functional capacity.
Okay.
She has done it. Okay.
Okay.
No problem, doctor. So now it's your turn, Dr. Venkat.
Okay, sir.
So let me give you some. Choose a case for you.
Can you give us this recording also, Dr. Te?
Yes, doctor. Don't you know this recording is provided to all the active participants? Doctor.
That I again listen and just criticize myself. Where is I have more improved, and there is some tone, voice, and where slowness needed. Okay, thank you.
Exactly, doctor. That has to be done must. So, Dr. Kat, I'm giving you the case. It's just a matter of practice. Long clinical consultation is not that much difficult that we used to think. Is this your case, doctor?
Okay, sir.
Okay, Dr. There, I have one question. It is not related to this case.
Yes, doctor.
There is some like AP fistula. When I raise the hand, there's a collapse of the AP fistula. Actually, I do not have any knowledge regarding this test. What actually this collapse mean? Is there is a not feeling of bruit or thrill,
Whenever,
or
no,
what
no,
is this?
the patency of the epifistula is decreased whenever you raise the hand, if the fistula
Mhm.
is functioning. But if the fistula is not functioning, it will be there.
Mhm.
The patency will not be decreased even after raising the hand.
How can I check this patency? Till I don't have any idea. I don't do
Yeah,
this test any.
we have to feel it and raise the arm to see whether it collapses. When it collapses, you'll automatically feel it that the lumen becomes narrow.
Oh, yeah. And bruise and or thrill, it is intact, or just only lumen is narrow? What is this? And how I can feel?
Whenever the fistula is not functioning, you will not find any
Mhm.
bruit. If you find any bruit,
Okay.
that means the fistula is functioning. So it will automatically collapse after raising the arm.
Okay. So when raise the hand, if I feel, is there any thrill? Or I have to auscultate it when it raise the hand?
Yes.
How I can
Yes.
confirm?
Sorry, I did not get your point, doctor.
When the hand is raised, just I only patency test by feeling the thrill, or I have to, at that moment, I have to again auscultate this area to
No,
check the breath.
there is a cord-like feeling. Whenever there is a cord-like feeling, and this cord-like feeling is lost after raising the arm, this means
Okay, okay, thank you. Yes,
it is collapsing.
yes, is there. Okay. I understand now. Okay.
And this is not that much important. The important point is the bruit and thrill, and also the pinprick mark. That is the most important. Also the localized sign like redness, swelling. You can do this raise arm test secondarily if you have time. But the main part of the examination is looking for localized sign, then pinprick sign, and thrill and bruit.
Okay.
Are you getting my point, doctor? Okay.
Yes.
Are you ready, doctor? Dr. Venkat, can you hear me?
Sir, we can start, sir.
Okay, doctor, start.
Okay, sir. Hello, my name is Dr. Venkatra. I am one of the doctors in the clinic today. May I confirm your name and age, please?
Yes, doctor, I'm Mrs. Anderson and I'm 50 years old.
Okay. Hello, Mr. Anderson. I am here to discuss regarding your health, and I will also be examining you today, and I will take some notes which will be very confidential. Is that okay with you?
Sure, doctor.
Okay, so can you tell me what brings you to the clinic today?
Doctor, I'm having some severe low back pain for the past 5 days. In the history, I never had experienced this kind of back pain, doctor. Please help me, doctor. I cannot tolerate this pain.
Okay, sure. I will definitely help you with your back pain. And very sorry to hear that. Would you have any drug allergy to any pain medications?
No, doctor.
Would you like to have get me you some painkillers right now?
Exactly, doctor. It will be very much helpful.
Sure. I'll after the meeting, I'll just ask the nurse to get you some painkillers. Is that okay?
Okay, doctor.
Okay. Can you tell me where exactly you have the back pain?
Patient is showing her lower back at the musculoskeletal, at the lower back, at the end of the spine.
Okay. Okay. So can you tell me how did this start?
It started quite suddenly, doctor.
Okay. Okay. Were you bending forward, or were you doing some work during that time?
No, doctor. I was sleeping, and suddenly I wake up from the sleep for this back pain, doctor. I don't know what has happened with me, doctor.
Okay. So you said it is very severe, right? So on a scale of 1 to 10, how do you rate it? 1 being least and 10 being the maximum.
Doctor, it is 7 out of 10, doctor.
Okay. So that must be quite troublesome for you, I guess.
Yes, doctor.
Does the pain go anywhere else?
No, doctor.
Okay. Anything which increases the pain?
Whenever I move, the pain increases, doctor. That's why I stopped moving, doctor.
Okay. Anything that like relieves the pain?
No, doctor. I have not tried for any painkiller or anything like that.
Okay. Okay. You have any other joint pains apart from this back pain?
No, doctor. Only this
Okay.
back pain.
Okay. So is it the first time you're having this pain?
Yes, doctor. This is the first time.
Okay. Do you have any morning jamming along with it?
No, doctor. No morning gym is there.
Okay. Do you have any weakness in your legs?
No, doctor.
Okay. Have you got any problems with making intimate relationship
No,
since
doctor.
the pain? Okay. Any tingling or numbness in the legs?
No, doctor.
Okay. How about your bowel works and water works? Is that okay?
Yes, doctor. It is okay.
Okay. Do you have any fever?
No, doctor.
Sorry, raised temperature.
No, doctor.
Okay. Do you have any aches and pains anywhere apart from the joint pain?
No, doctor.
Okay. You have anybody noticed that you have become paler than before?
No, doctor.
Okay. How about any lumps and bumps anywhere in the body?
I have not noticed any lumps and bumps, doctor.
Okay. Um, any weight changes you noticed?
I have not noticed, doctor.
Pardon?
I have not noticed any
Okay. Okay.
noticing.
Okay. How's your appetite?
It is quite normal, doctor. Not that much appetite
Okay.
lost.
Okay. Okay. How's your sleep?
I cannot sleep due to this pain, doctor.
Okay. Does it wake you up in the night?
Yes, doctor. This pain wakes me up at the night.
Okay.
Doctor, follow the tricks.
Yeah. So, any do you have any past illnesses that I know of?
Yes, doctor. I used to have some 10 years back. I was having some breast cancer, doctor, and I took the treatment for that, and I was declared completely cured, doctor.
Okay. You had breast cancer, is it?
Yes, doctor. It was
Okay.
cured, doctor. It is nothing. This is it's completely different thing.
Okay. 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 So, did you notice any lump again somewhere else? Again,
No,
once again,
doctor.
have you
No,
noticed?
doctor.
Okay. No. So, what medications were you on previously?
I took the chemotherapy and also undergone surgery.
Okay. Okay. Fine. Mm. So, are you on medications right now?
Right now, I'm not taking medication. I used to have follow up, but for the last 2 years, I didn't go for any follow up, doctor.
Okay. Apart from this breast cancer surgery, have you had any other surgeries?
No, doctor.
Any previous hospitalization?
No, doctor.
Any recent procedures
For
you have
this,
had?
yeah. Previously, I was admitted to hospital for this operation.
Okay. For the surgery you meant?
Yes, doctor. For the surgery
Okay.
and for the chemotherapy.
Okay. 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 Fine. Do you have any drug allergies?
No, doctor.
Do you take any over-the-counter medications?
No, doctor.
Any illnesses that run in your family?
My mother also used this same kind of breast cancer.
Okay. I'd like to ask you some personal questions. Is that okay?
Yes, doctor.
How are your periods?
Doctor, I am not having periods right now.
Okay.
Stopped few years back.
Okay. Do you use any birth control pills?
Doctor, why I need birth control pill? I am not having a
Okay.
period, doctor.
Okay. No, I asked, have you used any birth control pills before?
Yeah, I used to earlier, doctor.
Okay. Okay. Fine. Have you had any, sorry to ask, have you had any pregnancy or any previous miscarriages?
No, doctor.
Okay. Do you smoke?
I used to smoke earlier, but after this breast cancer has been diagnosed, I have stopped smoking.
Okay. Do you drink alcohol?
Yes, doctor.
Okay. May I know how much?
About it is within social limit, doctor.
Okay. Okay. Fine. What do you do for living, Mrs. Anderson?
Doctor, I'm a retired banker, doctor.
Okay. So how is this impacting your daily life, this pain?
Doctor, for this pain, I cannot do my daily activity, doctor. This is hurting me a lot.
Okay. Okay, I understand, but please don't worry. We'll know what we'll get to the bottom of this once I finish the discussion. Is that okay? And I also offer
Okay,
some
doctor.
pain medications. Okay.
Okay, doctor.
Do you drive?
Yes, doctor.
Okay. So are you able to drive with this pain?
No, doctor.
Okay. So I suggest you to stop driving for time being until this pain becomes better and you are able to drive. Is that okay?
Okay, doctor.
Okay. Um, so, sir, I would like to examine the patient now, sir.
Yeah, what do you want to see?
First, I would like to see her back. Just look
Yeah,
at the back if there is any cross visible, redness
absent.
or warmth. Okay.
Absent.
Then I would like to, with her permission or with the exam permission, I would like to see if I would like to check for any tenderness.
Yes, there is tenderness present. No need to palpate. Patient
Okay.
examiner tell you no need to proceed.
Okay. Okay. Now I would like to ask her, with her permission, if she can move her spine, move her back, both sides,
She
sideways.
cannot do this. Due to pain,
Okay.
she cannot do this.
Okay. Okay. Now I'd like to check her lower limbs.
What do you want to see?
I want to see for the tone, and also I want to examine the
Normal.
power of hip flexor and extensor, knee
Normal.
flexor extension, dorsiflexion, plantar flexion.
Normal.
I would like to check the reflexes, knee jerk, ankle jerk,
Normal.
and plantars. I would also
Flexor.
like to so it is normal, sir. Reflexes
Yes.
are normal.
Normal.
Okay.
No, flexor.
I would also like to check the offer sensation, touch, fine touch,
Normal.
and vibration of the lower
All are
limbs.
normal.
Okay. Now I'd like to check for her hands for any pallor.
Absent.
Okay. Then I would like to check for previous. If the permission, I would like to check her chest for any previous scars,
Okay, noted, doctor.
breast surgery scars, and also I would like to feel for any lumps if she's having.
Where you would like to feel?
The breast and axilla, sir.
Okay, noted. No need to proceed.
Okay.
Anything else? 2 minutes left,
Then
doctor.
so Dr. Mr. Anderson, do you have any concerns for me?
Doctor, why I'm having this back pain, doctor?
Based on what I have examined and discussed with you, there is a possibility that this back pain could be due to the recurrence, the recurrence of your breast cancer. So that is a possibility for now.
What? What are you saying, doctor? I was declared cured, doctor, 10 years back. How can it happen again, doctor?
I can understand you are very apprehensive, and I do appreciate your concern. But I said that this could be a possibility, but before confirming, we have to rule other certain things out. Okay, it could be some. We have to get some scans done, and then I can tell you in a better way if that is the reason or if there is some other reason.
Okay, doctor. Doctor, for this back pain, do I need to get admission, doctor? Because I'm feeling severe pain, doctor. I need to relieve this pain.
Well, at this moment, we can help you with pain medications, and if it is not relieving, it's not relieving the medication, or if you find having any difficulties with your waterworks or bowel works, or if you find any weakness in your legs, or if you find any loss of sensation in your legs, then we can admit you immediately and work up further and give you medications. Is that okay?
Okay, doctor.
Okay. Any other concerns you have?
No, doctor.
Okay.
5 seconds left.
Yeah. So, Mr.
3,
Sanson, yeah.
2,
So I would.
1. Stop. Time's up, doctor.
Okay.
So, doctor, do you have any diagnosis or differential diagnosis?
Yes, sir. I have some differential diagnosis, sir. So one thing possibility is it could be recurrence of our cancer, metastatic recurrence, sir, to
Okay.
her bones. Second thing, it can be some mechanical back pain, sir, but though she does not give any history of sudden bending or sudden movement, sir. That is one of the differential.
Wonderful. So, doctor, what are your positive physical findings?
Sir, on examination, I could I could see there is some kind of tenderness at the lower back where she's pointing towards pain.
Okay.
Apart from that, I could see note the old surgical scar and of her previous surgery, sir.
Are you sure, doctor?
Sir,
Any other positive physical findings?
sir, as such reflexes, lower limb, everything was normal, sir.
Sure. Are you sure? No positive physical findings?
Tenderness and there is limitation of movement of her at the joint, sir.
Okay, doctor. So, how we are going to investigate?
First, I would like to first confirm the diagnosis, sir. So I would like to take a X-ray of her spine, a lumbosacral spine, to look for any evidence of some lesions or any evidence of fracture or any evidence of collapse, vertebral collapse, or metastatic recurrence, sir.
Okay.
Okay,
Anything
and
else?
then, sir, I can, if it is not visible on the X-ray, I would like to do a MRI of spine, sir, LS spine.
Okay. Anything
And
else?
then I would like to rule out. No, sir. These are the two investigations I would like to do, sir, on her.
Okay, doctor, how are you going to manage?
Sir, firstly, I would like to offer her some painkillers, sir, for medications, and also I would like to ask her to have some lumbar belt, lumbar support, so that the movement is limited and her pain would be minimal. And then I would like to investigate, apart from, in addition to the basic investigations, I would like to look for. I would also like her to do some investigations like X-ray, and X-ray lumbar spine and MRI spine.
How will you manage the doctor? How will you manage her?
Yes, sir. So one is I would give analgesics and I'll ask her for rest, like lumbar support. Then once based on the investigations, further I would like to take a call based. I'll form a multidisciplinary team and then take a call based on what her diagnosis would be, sir.
Suppose this is a case of metastasis. What will be the management, doctor?
Sir, if it is a case of metastasis, I would. There are options for treatment, sir. It can she can radiotherapy can be given, or bisphosphonate therapy can be given with on discussion with an oncologist, sir.
Okay. Okay, doctor. Let me analyze your performance. Doctor, I was just testing you.
Okay, sir.
It is done frequently in the PACES exam.
Okay,
You have
sir.
told the positive physical findings. You are right.
Yes, sir. Yes,
but
sir.
to make you confused, the examiner might some ask you that, are you sure?
Okay,
Do you have
sir.
any other positive? This is just to provoke you that you do some synthesis of anything.
Okay,
so
sir.
don't be don't be bothered about this. If you are confident
Okay.
enough, just tell
Okay,
that
sir.
thing.
Okay, sir.
Are you getting my point?
Yes,
Don't
sir.
be frightened.
Yes, sir. But I did not see the scar, no, sir. I assumed there would be a scar.
Yes, doctor.
So,
but
yeah.
This in the PACES exam, what I have told, omitting is better than committing. So
Okay,
sometimes the examiner sometimes tests you that whether you are confident enough or not. Are you sure, doctor? Any other positive
Yes.
physical findings? Any other? Sometimes they can ask you in certain way. So
Okay, sir.
don't utter anything which you are not confident enough.
Okay,
Are you
sir.
getting my point, doctor?
Okay, sir. Okay, sir.
So it was a case of low back pain, possibly related to metastasis. So let us start from the physical examination.
Okay, sir.
In the physical examination, you have done first to confirm your diagnosis. You have examined the lower back. You have examined the movement of the lower back.
Yes,
Then
sir.
to find out the cause, it is a metastasis. It can be
Yes, sir.
evident only from the history, not
Okay,
from
sir.
the physical examination.
Yes, sir.
Then for the complication, you have examined the lower limb, right, doctor?
Yes, sir. Yes, sir.
But did you check the gait?
No, sir.
And in the physical examination recording, I have told it again and again, any low back pain, any knee pain, any hip pain, any ankle pain, we have to check the gait. Are you getting my
Okay,
point?
sir.
Why gait is important? To look
Okay,
for
sir.
the complication. You have examined the lower limb, it is good,
Okay, sir.
but
Okay,
also
sir.
check for the gait.
Okay, sir.
Then, for the association, actually, low back pain here is due to metastasis.
Yes, sir.
So, this cancer can also spread to other body parts. Like this patient can have hepatic metastasis, right, doctor?
Okay, sir. Okay, sir. Okay, sir.
So, this other complication will fall under the association here. Are you getting my point? Why this is association here?
Okay, sir.
So you have to examine for hepatomegaly here and also for
Okay, sir.
ascites. You have to palpate the tummy. Did you do
Okay,
the
sir.
abdominal examination? Because this
No, sir.
patient
No,
can
sir.
have some metastasis with the abdomen.
Okay, sir.
Are you getting my point? Why abdominal
Yes, sir.
examination
Yes,
is
sir.
important? How the
Okay, sir.
triple CA fits here. If you
Okay,
approach
sir.
through this triple CA, you will
Okay,
never
sir.
miss any important physical examination.
Okay, sir.
So for missing these two important examination, you will get borderline here. Identifying physical sign is wonderful. You will get satisfactory here.
Okay, sir.
Regarding clinical communication skill, never tell drug allergy. Tell
Okay, sir.
medication allergy.
Okay, sir.
Drug is used only with the party drug.
Okay, sir. Okay, sir.
Never take medication allergy.
Okay,
Then
sir.
show some empathy. Like when the patient tells you that my mother also had some breast cancer. After that, the next question will be, I'm sorry to hear that. How she is
Okay,
doing
sir.
now?
Okay, sir. Okay, sir.
Are you getting my point?
Okay, sir. Okay, sir.
This is the way you have to show the empathy.
Okay,
That
sir.
then also she has told you that I have stopped smoking after the breast cancer diagnosed. Have you given some good good thing for her that you have done the right thing? I congratulate you for that. Have you told her something like that?
No, sir. I just told that is good. That's
Yeah.
all I told, sir.
No, you have not told that is good.
Not told, sir. Okay, sir. Okay, sir.
Just tell me that yes, you have done the right thing. If
Okay,
you
sir.
tell this
Okay.
thing, the BTS is think that you are a professional doctor. You are empathetic to the doctor. You are
Okay, sir. Okay.
okay, doctor. So
Okay,
there
sir.
was a
Okay,
lack of
sir.
empathy, little bit.
Okay. Okay, sir.
So this actually no mark will be cut for this, but
Okay,
remember
sir.
this thing.
Okay, sir. Okay, sir.
Differential diagnosis is wonderful. In the clinical judgment, you did not start with the apart from basic investigation. This is a big mistake, doctor. In the management, you are telling later, but you have missed this earlier. Sometimes the examiner is an old guy. So if you miss the apart from basic investigation, you are likely to lose your mark.
Okay, sir.
In the investigation, apart from basic investigation, first to confirm my diagnosis, I would like to do X-ray, then MRI if needed, then
Yes, sir.
MRI guided biopsy.
Okay, sir. Okay.
Then to find out the cause. So to confirm my diagnosis, and then to find out the cause, it will be evident from the biopsy report.
Okay, sir.
Then to find out the complication, no investigation is required here because there is no, from the examination, we have not got any compressive fracture.
Yes, sir. Yes, sir. Yes, sir.
Yes, are you getting me? Then
Yes,
to
sir.
find out the association, I would like
Okay.
to do full body scan in the form of ultrasonography of the tummy, CT scan of the chest and tummy, also the PET scan, whether
Okay.
there is
Okay, sir.
any evidence of other metastasis.
Okay,
Are you
sir.
getting my
Okay.
point?
Yes, sir. Yes, sir. Yes, sir.
This is the way you have to tell the investigation, so you will cover all the things and the examiner will be happy.
Okay,
Then
sir. Okay.
during management, this is a stable case, all right. You have to start with education and counseling, forming a multidisciplinary team.
Yes,
You
sir.
have not told it. You are just telling that painkiller. Never start like this. Start with like
Okay, sir.
education and counseling, forming a multidisciplinary team. Then
Okay, sir.
giving pain.
Multidisciplinary, I told, sir.
Yeah, told, but in a
Yes, sir.
haphazard way.
Yes, sir. Okay, sir. Okay, sir. Okay, okay, okay.
Tell in a
Okay, sir.
professional way.
Okay, sir. Okay, sir.
Then giving painkiller. Then treatment of the underlying cause. After that,
Okay.
pause.
Okay, sir.
If the patient tells you that, if the examiner, suppose the cause is metastasis, how will you manage? So in like
Okay,
that,
sir.
I will refer him to the oncology department.
Okay, sir.
Then according
Okay,
to
sir.
the comment, I will give the management. This is
Okay,
not
sir.
your job to
Okay, sir.
manage a metastatic breast cancer patient. It will be
Okay,
done
sir.
by the multidisciplinary team. but
Okay,
they
sir.
will see whether you are able to refer this patient, whether you are able to arrange a multidisciplinary approach for this.
Okay, sir. Okay, sir.
Are you getting my point, doctor?
Yes, sir. Yes, sir. Yes, sir.
So in the clinical judgment, you will get borderline.
Okay,
Concern
sir.
is okay. Maintaining patient welfare is okay. So if we calculate 2 plus 2, 4, 4 plus 1, 5, 5 plus 2, 7, then 9, then 11, then 1, 12. So you have got 12 out of 14 from each examiner. If you
Okay, sir.
multiply it into 2, it will be 24 out of 28.
Okay, sir.
Is it clear, doctor?
Yes, sir. Sir, sir, so suppose this is metastatic breast cancer. So then
Yes.
shouldn't we not examine the lungs also, sir, for lung meds?
Must. Yes, yes, doctor. Of course, I have missed this. Yes, also, doctor.
Yes, sir.
Thanks.
Yes, sir.
Just do auscultation, nothing
Oh,
else
sir.
needed.
Yes, sir. Okay, sir. Okay, sir. Okay, sir.
Just do auscultation. Yes,
Okay,
doctor,
sir.
I have missed this, doctor. Sorry.
Okay, sir. Okay, sir.
So,
No, because
always,
when you told CT thorax, then only I recollected. Okay, lungs also a common site of meds.
yes, doctor, this will
Okay.
fall under the association here. That
Yes,
is
sir.
why
Yes, sir.
approaching the triple CA will make you safe. If you start examining from the hand blindly, like
Yes, sir.
I would like to do some general examination, looking
Yes, sir.
anemia, glossitis,
Yes, sir. Yes, sir.
sometimes you will miss some important examination.
Yes, sir.
But
Yes,
if
sir.
you follow in this way, you are unlikely
Okay,
to
sir.
miss any important part of the examination.
Okay, sir. Okay, sir.
Okay, doctor?
Okay, sir.
Okay. Do you have any question from the scenario?
No, sir. But I actually, I mean, I did not ask gate. Maybe I forgot, or I'm not sure. But you said it was limited. I mean, she cannot flex and this thing. No, so I didn't offer gate actually. But
You have to offer it.
okay,
Whether
sir.
she
Okay,
will
sir.
walk or not, that is
Okay,
hard
sir.
decision. The examiner
Okay,
can tell
sir.
you that no
Okay,
need,
sir.
but
Okay,
you have
sir.
to
Okay,
offer.
sir. Offer. Okay, sir. Okay, sir.
Okay, doctor. So
Okay.
do anyone have any question? Any other candidates have any question from this scenario?
Yes, doctor, I have one question.
Uh,
Yes,
Sorry,
doctor.
you can proceed first.
Sir, sir,
Okay.
I have one question, sir. So, sir,
Okay, Dr.
can I go, sir?
Sushmita. Okay, Dr. Sushmita, I am coming back to you. Yes, Dr. Venkat.
Okay, doctor. Okay.
Yes, sir. So, sir, this one, sir. So, so based on history, we are assuming that it is to be metastasis. And
Yes.
if she asks what is happening, so can we like directly tell, or should we like do like a Breaking Bad or something like that, sir?
You have just tell the right thing. One of the possibilities is that there can be some spread of cancer.
Okay.
And you are not sure enough. You have just told the right thing that we are not sure enough right now. We have to
Okay.
run some tests. After the
Okay.
test results are available, we will sit
Okay.
with you again.
Okay,
This
sir.
is the smart way to keep you. Like whenever
Okay,
you
sir.
are not sure enough that whether you need to admit the patient or not, you just have to tell,
Okay.
I will keep you at the observation room. In the meantime, I will talk to my consultant. He will come and see you.
Okay, sir. Okay, sir.
Okay, doctor. You have to offer the differential diagnosis, not the definitive diagnosis all the time.
Oh, okay, sir. Okay, sir.
Okay, doctor. Yes,
Okay,
Dr. Sushmita Apu.
Dr. Dey, is there anything like that there's some scoring? Is it 7 or 8 for admission?
Yes, whenever there is any pain above 7, above 6, we can admit the patient for pain management. But if you are not confident enough, just keep the patient at the observation room and talk to your consultant.
So if as in that case, if there is a 7, so if I need to admit or just observation room?
You can go, sorry, can you repeat?
If it is 7 or more than 7.
Yes, you can admit the patient. Dr. Sushmita, are you getting me, myself?
Yes. Yes.
Yes, Dr. B has answered osteoporosis, osteomalacia. Yes, Dr. Venkat has already told that. Osteoporosis is another differential diagnosis. She probably any mechanical cause. I have given a written list of mechanical low back pain differential diagnosis that was discussed in the earlier lecture. And all the differential diagnosis you can put here, but you have to tell why this does not fit here. You have to tell the against point. So is this clear, Dr. B? Okay. So any other question from this scenario from any other candidate?
May I ask some question?
Yes, doctor.
Yeah, so for any patients who is having back pain, for the examination part, we'll have to do a back examination.
Yes, doctor.
We'll, we'll see the range of movement of the
Yes,
spine,
doctor. Yes, doctor. It is
and
one.
we'll have to do
At least check the
range.
back, whether there is any tenderness or not. And you can offer to check for the movement, but if there is severe pain, the patient will tell that I cannot do. But better to offer the movement. Check for the movement.
And we'll have to do lower limb lower limb
Must.
neurosurgery.
Must, doctor. This is to rule out the complication in the triple CA.
And on
Because,
both.
yeah,
So these are the four things we'll have to do.
for association.
Nee, for the examination part for anybody with a back pain,
Yeah,
we to do this back examination, range of movement, lower limb neurological examination, and gait.
yeah.
This is the
It will actually depend on the case scenario. And for each case scenario, it will be different in the form of triple CA. And for each case scenario, the range of physical examination you have to do, this is delivered in a separate recording to you. This will be delivered. And this has already been delivered to the active participants. You are joining from this session, so you will also get it during the next cycle.
Okay, Asha. So I'll get it in the during the
Yeah,
previous.
yeah. This a round trip occurs here. Anyone can join anyone. But right now, I have to stop the enrollment after 3 or 4 persons because I cannot give service more than 12 or 13. So after 12 or 13 becomes, I have to stop the enrollment. After that, all of the candidates have to wait for the next cycle. That will start from December 14. Another batch will start. But Dr. Shubhadeep, you will get access to the recording and all the things up to the next batch musculoskeletal prompt.
Okay, thank you.
Okay, doctor. Any other question from anyone? Okay. So let me go to another active person. Dr. Monisha, are you there? Dr.
Yes,
Monisha?
yes, I'm here.
Yes. So you have to practice right now. So doctor, are you seeing the screen?
Yes, I'm seeing the screen.
Okay. You have 2 minutes to take preparation.
How much time I'll get for the whole?
11 minutes, and I will give you warning after 9 minutes.
Okay. Okay, bye. Start.
Are you ready, doctor?
Okay.
Okay, start.
Hello, sir. I'm Dr. Jahan, one of the doctors working here today. Am I talking to 65 years old Mr. Watson?
Yes, doctor. I'm Mr. Watson and I'm 65 years old.
Okay, nice to meet you. Today, I'm going to talk with you about your health condition, and at the same time, I'll examine you. During our conversation, I'll take some notes, but assured it will be very confidential between us. And if you feel, please interrupt me whenever needed.
Okay, doctor.
Okay. So please, can you please in own words tell me what brought you here today?
Doctor, I'm having some severe knee pain for the past 3 days. It is bothering me a lot, doctor. Please help me.
Oh, sorry to hear that, Mr. Johnson. Can you please show me in which knee you are having this pain?
Okay, patient is showing his right knee to you. There is swollen knee of the right knee joint.
Redness, any redness present?
Yes, redness is present.
Okay. So you are having this pain for the last 3 days, right? It started suddenly or gradually, Mr.
It started gradually, doctor.
Gradually.
Yes.
Okay. Is it progressing?
Yes, doctor. Right now it is so severe that I cannot walk, doctor.
How much will you grade your pain scale? Like 1 minimum, 10 maximum?
6 out of 10, doctor.
Oh, I'm sorry to hear that. Is there any history of trauma?
No, doctor.
Okay. Anything that increases your pain or improves your pain?
Doctor, right now the pain is so severe that I cannot move my leg, doctor. I have not tried anything that can improve my pain, doctor.
Oh, I'm sorry to hear, Mr. Watson. At the end of the conversation, I'll try to figure out what's so bothering you, and I'll certainly give you some medication to relieve your pain.
Okay, doctor.
Okay, so Mr. Watson, can you please tell me, do you have any previous past medical condition that I should be aware of, like high blood pressure or sugar?
Yes, doctor. I have high blood pressure. I have high blood sugar for the past 15 years, doctor.
Okay, I'm sorry to hear that again. Okay, Mr. Watson, can you please tell me,
And also I have some wiring and tearing of my knee joints.
wiring and tearing of your knee joint?
Yes, doctor.
For how long?
It's been there for the past 2 years, doctor. The doctor told me that I'm having some wear and tear and I have to take medication for that, doctor. I'm taking paracetamol. But right now the pain is so severe that in spite of taking paracetamol, the pain is not going away.
Okay. Do you have any other joint pain, like any other body parts? Do you have joint pain?
Yes, doctor. I have also pain at my left knee. But the pain is not, the pain is there earlier from there. But the pain is not that severe, that like the right joint, right knee joint.
Okay. And do you have any previous hospitalization history for any surgery or procedure?
No, doctor.
Any past blood transfusion history?
No, doctor.
Any travel history?
No, doctor.
Any contact with sick patient?
No, doctor.
Any injury to any side of your body?
No, doctor.
Okay. Okay. So you are for the pain you are having. You told me that you are having pain in your left knee on and off.
Yes.
For this,
Right
you take any right knee. Oh, sorry.
Yes.
Right knee. For this, you take any medication through your blood channel, like any injection you give there.
No, doctor. Where, doctor? Blood channel or something
Blood
somewhere
channel.
else? No.
Blood channel or by or through your knee, if in injection or some
Yes,
syringe.
doctor. Yes, doctor. I took some knee. Actually, I have some wearing and tear of my pain, and to relieve the pain, the doctor has given me some medication 5 days back through my knee joint. And the
Okay,
pain
through
is
your knee joint, you take
yeah.
syringe.
I
Okay.
did not take it. The doctor gave me to relieve my pain.
Okay. I understand, Mr. Person. Okay. It was around 5 days back. So,
Yeah.
Mr. Johnson, may I see your medication chart?
Yes, patient is showing you the medication that he is taking short-acting insulin actively 2 times daily and long-acting insulin at the bedtime.
And okay, are you compliant with the medication?
Yes, doctor, I'm quite compliant.
May I know what was your last 3 months average blood sugar?
It was about 6.9%, doctor.
6.9%. Okay. Are you compliant with diabetic diet or exercise?
Yes, doctor, I'm compliant.
And any episode of previous high blood sugar or low sugar?
No, doctor, nothing has happened like this up to
Okay.
now.
And do you have fever, Mr. Watson?
Yeah, I feel so. Sometimes I feel some rise of temperature, doctor. But
For
even
how
though I
long?
have not measured it, it's been there for the same period, doctor.
What is the highest recorded temperature, Mr.
I
Watson?
have not recorded it, doctor. Sorry to
Okay.
say. I feel it's feverish, but I have not measured, doctor.
Okay. Any diseases running in your family?
My mother also used to have this high blood sugar, doctor.
Okay. Okay, Mr. Johnson, do you have headache or vision problem?
No, doctor.
Sorry, Watson. Okay. Any tingling numbness?
No, doctor.
Any weakness in any part of your body or previously?
No, doctor.
Okay. Any chest pain or recent pressing of heart?
No, doctor.
Shortness of breath or cough?
No, doctor.
Bleeding from any parts of your body?
No, doctor.
What about your back passage?
It is normal, doctor.
Any tummy discomfort or
No, doctor.
what about your water work? Any increase in water work or decrease or foodiness?
No, doctor. It's normal, doctor.
Okay. Do you feel dizzy while sitting from standing position?
No, doctor.
Like you feel full after eating early?
No, doctor. No, doctor.
Wow, you feel sweating while eating?
No, doctor.
I'm sorry to ask this personal question. Do you have any problem with your intimate relationship?
No, doctor.
Okay. Okay, Mr. Orson, I want to examine you. I want to check the patient. I want to expose the patient with your permission, and I want to check at the look. I want to check if there is any redness, swelling.
Yes, redness present, swelling is present at the right knee joint.
Okay. I also want to compare with the left knee if there is any redness, swelling present or not. I want to check.
Yes, present.
On the other knee, there is also present.
No.
Okay.
No. At the right knee.
Right knee. I want to check if there is any temperature rise. Comparing with the his thighs.
Yes.
Okay. I want to check the tenderness. Do you have a pain here? And then I want to check the tenderness.
Yes, I am feeling pain.
Okay. Should I pause it?
No need.
Okay. Okay. I want to. Can you? Okay. I want to check the patient's gait. Can you please walk for me at the particular examination? I want to check.
Noted. No need. Patient is feeling pain. He cannot walk.
Okay.
Noted.
I want to check bedside blood sugar and urine deficit and fundoscopy at later part of my examination.
Okay, noted, doctor.
Okay. Now I want to check his anemia.
Okay, not anemic.
I want to check the lower limb examination, tone, motor, power, reflex, sensation, coordination. If there is a globe and stroking pattern of sensory neuropathy.
Yes, present.
Both in hand and leg.
Yes, there is globe and stalking pattern. Neuropathy is present. So loss of sensation.
Okay. Do you smoke, Mr. Watson?
Yes, doctor, I do smoke.
How many sticks per day?
About 10 to 14 cigarettes per day for the past 30 years, doctor.
Oh, okay. Any amount of smoking is increased to health. So if you want, I can refer you to our smoking cessation clinic. I hope that will be okay for you.
Okay, doctor.
Do you drink alcohol?
Occasionally at the weekend with my friends and party.
Any episode of binge drinking?
No, doctor.
Okay. I'm sorry, Klaus, do you take any party medication?
No, doctor.
Any over-the-counter or herbal medication?
No, doctor.
Allergy to any medication?
No, doctor.
Okay. What do you do for living?
Doctor, I'm a retired banker.
So this condition is impacting your job or active daily activities?
Yes, doctor.
I'm sorry to hear that. If you want, I will refer you to our social healthcare worker for your condition.
Okay, doctor.
Are you financially supported? Okay, thank you.
Yes, doctor.
Okay. Do you drive?
Yes, doctor, I do drive.
Okay. Have you taken all the vaccination shots?
Yes, doctor.
Any recent episode of vaccination shot taking?
No, doctor. 2 minutes left, doctor.
Okay. So what's your concern, Mr. Watson?
Doctor, why I'm having this knee pain, doctor?
Okay. I want to ask this one question. Do you have changed? Do you have noticed any recent weight change?
No, doctor.
Okay. So, Mr. Watson, as far as I have talked with you and examined you, the possibilities in my mind that you have a condition called septic arthritis. Don't bother about the medical term. It is a condition when our joints are affected due to some bug infection. As you told me that you were having injection, you were having some medication through your knee joint like 5 days back. I guess there might have entry of any bug through this channel that occurred the pain in your right knee also. As you know, bug spread through our other knee. Are you getting me?
Okay, doctor. Doctor, do I need admission?
Yes, Mr. Watson, you need admission. I run some tests and I'll draw fluid from your knee joint. The knee joint are affecting. From there, I'll take fluid and run some tests and see what are you suffering from. Also, I'll do some imaging. I'll involve a multidisciplinary team as well. They will help you as much as possible, and I'll get back to you as much as possible to relieve your pain. I hope it's okay for you. Anything you want to know, Mr. Watson?
Okay, doctor. Doctor, is it curable, doctor?
I hope so. It's most likely curable, but we'll be in better condition to tell you more details after running this test and get back to you. We'll start at first as soon as possible some medication to relieve your pain.
Okay,
team
doctor.
will decide you for this.
Okay, doctor. That is very kind of you, doctor.
Thank you. Anything you want to know from me?
No,
Any other
doctor.
question?
No, doctor. 5 seconds left. Okay, doctor. Time's up. So, doctor, do you have any diagnosis or differential diagnosis?
Sir, as far as I have worked this 65 years old Mr. Person, after talking with him, after and taking history and examination, the possibilities in my mind that he had a condition called septic arthritis.
Okay, do you have any other differential diagnosis, doctor?
And he might have osteomyelitis, though the duration is less, but it will be a second differential diagnosis.
Osteomyelitis? Sorry, doctor. Yeah. Okay, doctor. Any other TT you want to rule it out? Hello?
And I also like to rule out osteoarthritis, as I think from the history he might have a condition called long-term osteoarthritis. So I also want to check his other joint as well. But right now for this knee, I rule out septic arthritis.
Okay, doctor. So, doctor, what are
And
your
he might have a condition called gout. I'll offer for this our from
Why gout? Why gout, doctor?
sorry, pseudogout. I said pseudogout.
Why pseudogout?
As pseudogout may affect knee also, but I'll put it at the list of my differential diagnosis.
Okay.
And,
That is a way.
and there is another possibility in my mind that for monoarticular presentation of rheumatoid arthritis, but it's less likely as the patient age and sex. And this might be a cause
Doctor,
as well.
Doctor, don't go further.
Okay.
Approach simpler way. Mechanical causes of knee pain. What was the mnemonic? Ghost. So
Okay.
the rheumatoid arthritis is inflammatory knee pain. Are you getting me? So whenever you utter the word rheumatoid arthritis, you are digging your own cave.
Okay.
The thing you have told is wonderful. But never tell anything extra, even if the examiner poke you. Okay, doctor. Gout is not, you can tell the differential diagnosis of gout, but against that, you have not got anything from the history. Like that, the mnemonic was DHL. You can tell like this. You can tell all the differential diagnosis of mechanical knee pain. Never go to the inflammatory knee pain. If you go in that way, then the examiner will keep you stuck at that point. So how you're going to investigate, doctor? What are the positive physical findings, doctor?
My positive physical findings in this patient is there is swollen redness and swelling of his right knee joint, and there is also temperature raised tenderness present, and there is presence of global stroking pattern of his both hand and leg. And as I wanted to know his phonoscopy and urine deposits, he might have some other features of diabetic complications as well. And I can see his diabetic is not so controlled.
Okay.
From history.
So how you are going to investigate, doctor?
Apart from the basic investigations, I run some tests, and among the basic investigations, I'll do CBC to see if there is an infection, neutrophilia present, and ESR, CRP, and I'll do as soon as possible, I'll aspirate fluid from his right knee joint and send for study for microscopic ground staining culture and crystal study. as well, and I'll do imaging, that is extra, of the affected joint. And to find out the for other association, I'll also run some tests for his diabetic complications as well. If there is a fasting blood sugar and HbA1c, how is his B1C is going on.
Wonderful, doctor. So how are you going to manage?
First, I'll admit this patient, and I'll check if there is any needed for airway breathing circulation is intact or not. Then I'll educate and counsel the patient about his condition for my multidisciplinary team. Then I will start IV antibiotic as soon as possible, sending the fluid study. I'll start antibiotic, and I'll also arrange a referral to our rheumatology department for further consultation with them.
Never ever, doctor. Why rheumatology department? This is not a inflammatory type of pain. So why? Better you can offer to the orthopedics department.
Okay, sorry.
So nothing extra things has to be told. I have already delivered the recording what to tell in the investigation and management. Are you getting myself, doctor? So whenever you are telling anything extra which does not fit with this, you can put some trouble into yourself.
Okay, I forgot one thing. I
Yes.
forgot to mention PTINR.
Yes, after doing PTINR aspiration. No, doctor, no problem, doctor. You have done wonderful, doctor. So let me analyze your performance. So this is a case of knee pain. This was a case of septic arthritis. Look, for the past medical history, we have to ask all the questions. You had to ask any recent procedure. I have delivered all the 8 questions we have to ask. Then this case is dependent on the past medical history. In the physical examination, wonderfully, you have examined all the necessary physical examination. So you will get satisfactory here. Identifying physical signs is also very good. In the clinical communication skill, there is no major mistake apart from showing for some empathy. Like the patient told you that my mother also is also having high blood sugar, was also having high blood sugar. After that, you have to tell like this, I'm sorry to hear that. May I know how she is doing? This is to show the empathy. Are you getting myself, Dr. Monisha?
Yes.
But these will not cause any mark. This will not affect your mark. But better to tell you to make some good impression to the examiner. And wonderfully, you have asked about the medication allergy. Also, I have told you that yes, I jibe. Yes, jibing is not essential in this case. So you will get satisfactory here. Differential diagnosis is very good. Clinical judgment is very good. But remember, you have told about you may need to take some sniff test, but also tell the patient that after your permission. Are you getting me, doctor? Hello?
Sorry, I didn't understand. I didn't understand what you're saying.
You have told the patient at the aspiration that you have to take the fluid from the joint.
Yes.
Okay.
Yes.
Then you have to also tell it we may need to take some fluid from your joint after your permission, because this is a procedure. Yeah, after your permission, because in the UK, permission is necessary. This is a procedure. So before any procedure, you have to take the permission. Are you getting myself, doctor?
Yes.
So better to ask it. But if
And you'll have to mention it as a sleep test.
No, it is not fluid test. We may need to take some fluid from your joint after your permission.
I missed the line after taking permission. Okay.
Yes, it is applicable for any kind of aspiration, any kind of sniff test, that is biopsy, any kind of endoscopy, colonoscopy, that is camera test. Yes. Whenever you have to offer any test, inform the patient. Whenever you have to do any invasive procedure, inform the patient during meeting consent that we may need to do this test after your permission, after taking your permission. Then managing patient concern. Sorry, Dr. Shubhadeep asked which test. This is aspiration of the joint fluid. And for any kind of invasive procedure we have to do to the patient, we have to inform the patient during meeting consent. Like we have to run this test. Like sometimes for any case of hematemesis, we have to do the endoscopy. For any case of hematochezia, we have to run we have to do the colonoscopy. So for any case of lymphoma, we have to do the biopsy. So we have to inform the patient using in a non-jargon way about the test and also inform the patient that we have to take your permission before going for the test. Is this okay, Dr. Shubhadeep? And managing patient consent is okay. Welfare is okay. And wonderfully, doctor, you have got 14 out of 14 in this case. So it is 28 out of 28. Wonderful, doctor. Very good. Very good, doctor. Do you have any question, Dr. Manisha, from this case?
No, actually, I have not confident, and that's why I told about gout, and I'm sorry for that.
No, gout is not, gout will not be a differential diagnosis here, but you can tell it as a differential diagnosis, but
Yes,
it is not the main diagnosis here. You can tell it in differential diagnosis. Let me see if there is any question left. Charcot joint,
So-
no, for knee joint, Charcot joint cannot be told. Charcot joints usually affect the ankle joint. Doctor, we have asked about the Charcot joint actually. Okay.
So there is 3 DD, septic arthritis, gout, and osteoarthritis. This in this period.
Yes, you can tell.
Okay.
All the ghost. Can you remember the ghost?
Yes.
Gout, hemarthrosis, osteoarthritis, septic arthritis, trauma. You can tell all that in the differential diagnosis of any mechanical knee pain. Just tell what goes against the DD, each DD. Are you getting my point?
Yes.
But you have to tell the primary DD. That is the provisional diagnosis. So, anyone? So let's go to the next candidate. Do you have any question from this scenario, doctor?
No.
Okay, doctor. So let's go to Dr. Shifa. Are you there?
Yes.
Okay, now it's your turn. Let me give you some case. So this is your case, doctor. Are you seeing the screen?
Yes, sir. I'm seeing it.
Okay.
One. No.
Are you ready, doctor?
Yes, sir. Can I start?
Okay, doctor, start.
Hello, I'm Dr. Shifa, one of the doctors in the clinic. Am I speaking to Mr. Johnson, age 35 years?
Yes, doctor, I'm Mr. Johnson. I'm 35 years old.
Mr. Johnson, we are here to discuss about your health condition. I'd like to ask you a few questions regarding your health, and I would also like to examine you. I will be taking down some notes in between. That will be completely confidential. Hope that is okay.
Yes, doctor, that will be okay.
Okay, Mr. Johnson. To start with, could you please tell me what brings you here?
Doctor, I'm having some low back pain for the past 7 days. It started gradually, doctor, and it is bothering me a lot. Please help me,
I'm
doctor.
Sure, Mr. Johnson. I'll see what I can do. Can you please tell me on a scale from 1 to 10, how severe is this pain?
Doctor, it is 6 out of 10, doctor.
6 out of 10. Okay, I'm really sorry to hear that. Are you okay now to proceed or do you need some painkiller?
Okay, doctor, I'm okay right now.
Okay, okay. Did you have any injuries to your back?
No, doctor.
Okay, where exactly on your back are you having this pain?
Patient is showing his lower back at the spine, at the end of the spine.
Okay, okay. And does it go does this pain go anywhere like to your legs?
No, doctor.
Okay. Do you have any jamming of your joint in the morning or when you take rest for some time?
Yes, doctor, I have morning jamming.
You have morning jamming, and how long does it last?
It just lasts more than 40 minutes, doctor.
It lasts more than 40 minutes. Okay.
Yeah.
Um, okay. And apart from this, okay. Uh, uh, do you have any pain in any other joints anywhere?
Yes, doctor, I also have pain at my right knee joint.
Your knee joint?
Yes, doctor, right knee joint.
Right knee joint. Okay. And this in your knee also, do you have this morning jamming?
Yes, doctor, I also have this same kind of pain, doctor. I don't know what is
Okay.
happening with me.
Any pain in your hand?
No, doctor.
Okay. Okay. And do you have any changes in your weight?
No, doctor.
Okay. Any changes, any lumps or bumps anywhere in your body?
No, doctor.
Okay. Do you feel tired all the time?
No, doctor.
Okay. Any raised body temperature?
No, doctor.
Okay. Any skin changes, any rashes or tightening of skin?
I have to notice, doctor.
You have noticed. Okay. And any weather preference?
No, doctor.
How is your water work?
It is normal, doctor.
How is your bowel work? Do you
It is
have any
normal.
loose stool? Or any bloody motion? Loose stool or bloody motion? No.
Not right now, doctor.
Okay, okay, okay. Did you have any recent illness, any loose stools or anything like that?
Yes,
Or any
doctor. 3 weeks back, I had an episode of loose stool.
3 weeks back you had an episode. Are you okay now?
Yes, doctor. I was on a travel to Uganda. There, I
Okay.
had this episode of loose stool, doctor.
You had traveled to Uganda. Okay, okay. And do you feel dizzy on standing now?
No, doctor.
Okay, okay. Can you please tell me more about this travel to Uganda? Could you tell me, did you take your shots before going?
Yes, doctor.
Okay. And why exactly was this a pleasure trip or for work?
It was a pleasure trip, doctor, with my friends.
Okay. Could you tell me what exactly you did over there? What kind of activities? Any contact with animals or bugs?
No contact with animals or bugs.
And how was your food and water? Was it like packed food, warm food and water?
No, doctor. Actually, it is not possible all the time. Sometimes we
Okay.
have to take some local food.
Okay, okay. And really sorry to ask, did you have any casual sexual encounters while there?
Yes, doctor. Sometimes I used to have.
Okay. Was it protected?
No, doctor, not all the time.
Okay, okay. Okay, at this point, Mr. Johnson, I'd like to suggest that it should always be protected because you could contract a lot of infections otherwise. Is that okay, Mr. Johnson?
Okay, doctor.
Okay, okay. And are any of your friends sick?
No, doctor.
Okay, okay, Mr. Johnson. And do you have any past medical conditions that I should know of?
No, doctor.
Okay, any allergies?
No, doctor.
Are you on any medications?
No, doctor.
Did you have any surgeries or procedures in the past?
No, doctor.
Do you have any illness running in your family?
My mother used to have some skin rash called psoriasis.
Your mother had psoriasis. Okay, okay. How is she doing now?
She's doing fine, doctor, with the medication.
Oh, okay, Mr. Johnson. Good to hear that. And may I ask you a few personal questions?
Sure, doctor.
Okay, do you smoke?
Yes, doctor, I do smoke.
How much and for how long?
About 10 to 14 cigarettes per day for the past 20 years, doctor.
Okay, Mr. Johnson, I'd suggest that smoking is really injurious to your health. I would suggest that you cut down and quit smoking. And if you need any help regarding that, I could refer you to a smoking cessation clinic. How do you think of that, Mr. Johnson?
Okay, doctor, that will be helpful.
Okay. Do you drink alcohol?
Yes, doctor.
How much and how often?
It is occasionally at the weekend. It is within social limit, doctor.
Okay, okay. Do you take any party drugs?
No, doctor.
Okay. What do you do?
I'm a businessman, doctor.
You're a businessman. Okay. And has this been affecting you a lot in your daily life?
Yes, doctor, to a certain extent. Actually, it is being very much difficult for me to attend a meeting with this low back pain.
Okay, I can understand that. We'll try to help you out. Okay,
Okay,
Mr.
doctor.
Johnson? Okay.
Okay, doctor.
And do you drive?
Yes, doctor.
Okay, okay, Mr. Johnson. Do you have any weakness or numbness or tingling in your legs?
No, doctor.
Okay, okay. Mr. Johnson, I'd like to examine you. Do you have
Okay.
any grittiness in your eyes
No,
or
doctor.
redness? Redness
No.
in your eyes? No. Okay.
No,
Any
doctor.
shortness of breath
No,
or
doctor.
chest pain?
No, doctor.
Okay, okay. Any cough or breathing difficulty?
No, doctor.
Any tummy pain?
No, doctor. Very
Okay,
good.
okay, Mr. Johnson. I'd like to examine you.
Yes.
Okay. So first, I would like to see the patient walk.
Okay, patient can walk
Okay,
normally.
okay, sir. Okay, sir. Okay. Then before he sits down, I'd like to examine his back, sir.
Okay, what you want to see?
Any deformity or
Absent.
any tenderness?
Absent.
Okay. Then I would like to check his range of motion of his neck, sir. Flexion.
Neck or
Backward,
lower back? Which one?
both neck. First neck.
Neck.
Forward
Okay.
flexion, backward flexion, sideways.
Normal.
Normal. And then back also. Forward flexion, sideways, both sides and backwards.
Okay, forward flexion is reduced to some extent, not
Okay.
full extent.
Okay, sir. Then I would like to do a modified Schober's test. I would like to mark a point
Okay,
above
noted. Noted,
okay.
doctor.
Okay, I would like to do a Walt oximeter test also.
Normal, doctor.
Okay, sir. And then I would like to examine his pulse.
Okay, what you want to see?
No, first I would like to see his nails for any changes, any pitting or
Absent.
anything.
Absent.
Okay. I would like to see his hand joints for any deformities.
Absent.
Okay. I would like to see his pulse.
Okay,
For
normal.
any collapsing pulse.
Wonderful. Normal.
Okay, okay, sir. I would like to do a general skin survey for any psoriatic rash, especially his elbows and behind his ears,
Absent.
hairline.
Then
Okay. Eyes for any redness.
absent.
Okay. And I would like to just to see his mouth. If it's okay.
Yes, normal.
Okay, sir. I would like to examine his knee then. Right
Okay,
knee.
no rash is present.
No, no. He said mentioned some knee pain, so I would just
Yes,
like to
yes.
see it look, feel,
Okay.
move.
Okay.
Okay.
There is no swelling present right now. Movement is normal.
Okay.
And there is no temperature is not raised.
Okay, sir. His lung apices and bases for
Normal.
any palpitations. Okay. Heart for any murmur of any aortic regurgitation or mitral
Absent.
area. Okay, sir. And his heel for any anything, any redness or inflammation.
Do you want to pinch it?
To check for any tenderness, yes, sir.
Yes, absent.
Okay, okay, sir. And any peripheral pulses also.
Normal.
Okay, okay, Mr. Johnson. What are your concerns?
Doctor, why I'm having this back pain, doctor? 2 minutes left.
Yes, Mr. Johnson, I think you have a condition called ankylosing spondylitis. Don't worry, I'll explain it to you. It is a defect in the body defense system when it is misdirected to your joints and sometimes to your other parts of the body also. We will run few tests just to be sure. We'll take a scan of your back and run few blood tests, and we'll start your medications and we'll suggest some exercise also, and you should feel better. Anything else, Mr.
Doctor, do I
Johnson?
need admission?
I don't think so, Mr. Johnson. We'll just run few tests and we can give you some referrals to our specialist, and you should be okay.
Doctor, is it curable, doctor?
Mr. Johnson, I am really sorry to say it's not completely curable, but it's manageable with regular medication and regular exercise and physiotherapy. It is quite manageable condition.
Okay,
Anything
doctor.
else, Mr. Johnson?
No, doctor.
Okay, if you have any questions at any point, you can always come back to us. Thank you for your time, Mr. Johnson.
Okay, doctor. So we have
Okay.
still 1 minute left. Better we start our cross questioning. So, doctor, do you have any diagnosis or differential diagnosis?
So I have differential diagnosis.
Well, what are differential diagnosis?
First one is ankylosing spondylitis.
Okay. Why?
No. First one is because he had a difficulty in forward flexion, backward flexion. Like he had difficulty in his sacroiliac spine joint tenderness.
Little extent, not that much.
Sorry, first differential would be reactive arthritis.
Yes, doctor. During meeting
Because of
cause,
his recent history of diarrhea
yes, and also another history is
and
there.
casual sexual contact.
Yes, doctor.
Yes.
Any other DD, doctor?
Next would be ankylosing spondylitis. Then it would be psoriatic arthropathy.
Okay.
Okay. Yes, sir. And then IBD related arthritis, but there is no loose stool.
There was history of loose too. 3 months, 3 weeks back.
Yes, 3 weeks back, one episode. Okay. Enteropathic arthritis. Yes, sir. Reactive arthritis, enteropathic arthritis, ankylosing spondylitis, and then psoriatic.
Yes, doctor. So, what are your positive physical findings, doctor?
So Mr. Johnson on examination had no deformities, but he had difficulty in range of motion. He had restriction of range of motion of his lower back. He had a restricted forward and backward bending and lateral movements, and also modified Schober. I'm not sure what.
No, it was not done. Just noted.
Okay,
Any other
okay.
positive findings?
And nothing else.
Okay, if you don't find anything, just tell I have not got any positive physical findings.
Okay.
Be confident.
Okay.
So, how you like to investigate?
Sir, apart from the basic investigations like complete blood count, ESR and CRP, and also a urine analysis and other renal function test and serum electrolytes, liver function test, I'd like to do to find out the cause. I'd like to do an X-ray of the joints, knee and his back. And other than that, I would like to do HLA-B27. Yes.
Okay.
Yeah,
Anything
yes.
else you want to do?
Yes, sir. I'd like to do an ECG and echo to rule out other complications like cardiac regurgitation.
Anything else? Okay. But how you are going to manage?
I would also like to check his viral markers, sir.
Okay. How we are going to manage, doctor?
Sir, I would like to educate and counsel my patient about his condition. I would advise him to stop smoking. I would suggest exercises to him, and I would involve a multidisciplinary team, including multidisciplinary team. Then I would treat him according to the course.
Suppose this is the case of reactive arthritis. What will be your treatment, doctor?
Yes, sir. I would give him NSAIDs for his pain, sir.
Okay.
And it is usually it will resolve.
Okay, doctor. Then follow up the patient. Okay.
Yes, sir. Sir,
Very
I think
good.
I forgot lower limb TPRCS.
Yes, doctor. You
Don't
have missed
forget
it.
neurological
Yes.
exam. Yes, sir.
But time is gone, doctor. It's a major mistake, doctor.
Yes, sir.
Okay, doctor. Let me analyze it. So it is a case of low back pain. It was inflammatory low back pain. So in the physical examination, you have understood, you did not examine the lower limb.
Yes, sir.
In the examination, in the feedback, typically they write it here. So it will be borderline. Identifying physical sign is okay. Clinical communication is wonderful. You have become professional by doing regular practice. You have asked the medication allergy, all the important thing, wonderful empathy, all the things were good there. Differential diagnosis is also okay. In the clinical judgment, it is also okay. Apart from basic investigation, you have to do such thing. Ruling out the complication, you have already told. No problem is there. Then managing patient consent is okay. Managing patient welfare is okay. So you have got 13 out of 14. Only to miss the lower limb examination, doctor.
Yes, sir.
So it will be 26 out of 28. Is it, do you have any question, doctor, from this scenario? You
No,
have
sir.
done, you have done well, doctor. You have done, you have taken the history in a more professional way. And this is the result of your regular practice.
Okay.
But only never forget to examine the lower limb. Just
Yes,
check the
sir.
plantar at least. If you don't have enough time, at least check the plantar. You have checked the gait, but did not check the plantar. So
Yes,
it
sir.
typically lost the mark.
Mm.
So do anyone have any kind of question? Let me check the questions. Any question to confirm sacroiliitis? No, doctor. Only we have to ask in the low back pain. This low back pain can be due to sacroiliitis or it can be due to the ankylosis of the vertebra, fusion of the vertebra. Okay. So, Dr. Shiva, do you have any question from the scenario?
No, sir. Like differentials would be as investigations you asked. Anything else? Anything else?
Yes, I was just pinching you to test your confidence.
Okay, sir. Okay.
Okay, and you can also do the sexually transmitted disease screening because
Yes,
he has a,
viral.
yeah, I have told this.
Okay,
You
sir.
have told this. So, do anyone have any kind of question from this scenario? If no question is there, I think Dr. Shubhati, we need to talk about joint fluid aspiration. No, for this case, joint fluid aspiration is not necessary to tell because there was no saline, and this will be likely a dummy case in the exam.
Sir, I have another question.
Yeah.
You have mentioned tapping the joint in examination. I know
Yes.
about tapping in the knee joint. Other joints, how do we do that?
No, only knee joint tapping is necessary. Apart from
Only
knee joint, yeah.
like we will press from thigh to knee, and
No,
then
no.
we will just no.
Yeah,
We will like bring
yeah.
all the fluid from thigh to knee downwards, and then we will just tap over it to see if it's
It is,
fluctuating. Patella.
yeah. Anyway, just you have to see whether any pitting formation is there or not. Because whenever there is fluid inside the joint, if you tap the joint, like if you make a pinch over the joint with your finger, there will be formation of depression over the joint. Am I able to make it understand? I don't know.
Okay, sir. Okay, I understood.
Just keep a just press over the joint to see
Okay.
if any dimple forms there or not. This is called tapping.
Okay, sir.
Okay, doctor.
Okay, sir. Thank you.
So, wonderful. No problem, doctor. You just continue to practice and you will do well. And Dr. Shifa is with us from the middle of the last course, and she has made wonderful improvement. Don't worry, doctor. You will be okay.
Okay, sir. Thank you.
Okay. So, any other question from any other candidates? So, if it is okay, then we can stop the session for tonight. And I'm going to deliver the recording in the Telegram group for the active participants, and also the PDF of the cases will be given there along with the recording of the physical examination, investigation, and management for each of the cases. Your task will be to go through each case and take preparation for each case separately. And after tomorrow morning, I will assign each one of you with a homework. You have to practice each another. You have to practice with each other. And you have to assess each other using the mark sheet. And you have to report it to me. And then the next session, you have to do one-to-one practice exactly from the same scenario. Okay. So good night, everyone. Take care. Have a nice sleep. Bye-bye.
Good night.
Good night, doctor.